Hi, I'm Dr. Brant Larsen. Welcome to the video. We're talking about 10 Lyme symptoms, common Lyme symptoms. There's going to be more, of course, but these are 10 very, very common ones. Now, my son, my oldest son, he's 14 right now at the time of this video. About 5 years ago, I think he was actually 6 or 8, he wasn't quite 9 yet, he got Lyme disease. And we actually saw it. I was helping him undress for the night and put his pajamas on and just getting ready for bed, and I happened to see a big bullseye rash on his back, and I knew right away, of course, what it was, and we'll talk about that in a second. But we got lucky. We got lucky that he had an acute case. So within a day, he couldn't walk. I had to carry him into the hospital, and he was stiff. He had joint pain. It was unbelievable to see how fast he went down from when I first saw that bullseye rash. I don't remember seeing a tick at all. I forget what we were doing, if we're even out in the woods or anything like that. But he went down very, very quickly. Now, luckily for us, the medical doctor that we went to, she said, you know, the testing isn't back in yet, but I'm going to treat him as if he has Lyme right away. Now, there were some other things that happened in that visit that I wasn't too happy about, but we'll focus on the good stuff here. And maybe at some other point I'll talk about some of the other things. But he was fixed. We got the antibiotic for him. We got him help right away. Now, I didn't just do antibiotics with him. I made sure to support his body on other levels with herbs and supplements and other things that I was doing, because I didn't trust just the antibiotic to do the job. Plus, I wanted to make sure that his body was supported. But again, I've had personal experience with this. It was not fun. So anyone who's ever had Lyme or has a child that has Lyme, it's not a fun process. Plus, there's acute versus chronic Lyme. And the chronic one is a tough one. That's where you don't see usually a bullseye rash and you don't know you have it. Okay, but here's 10 Lyme symptoms. Now, of course, the first one is a bullseye rash. And like I just said, a lot of times you don't see this. I've seen anywhere the data on this from 10% to 70% of the time you see a bullseye rash. The most common number I see is about 30% of the time. Okay, so that means 70% of the time you don't see the bullseye rash. So you can't just hang your hat on, well, I didn't have a bullseye rash, so I don't have Lyme. It doesn't work like that. This was my son's. I'm not sure how well you can see this on the camera, but this was his back up on his right shoulder, and you can see the red area around that bullseye type rash that he had. Number 2, headache. It affects your brain. It affects a lot of things up in the head. Number 3 is neck stiffness. My son had this. And you have to rule out meningitis and things like that as well. But Lyme can typically cause a neck stiffness. Number 4, arthritis, which is joint inflammation. Now, my son had arthritis. We have to understand this is not a disease, okay? Arthritis is not a disease. It's a name for joint inflammation. Arthro means joint, itis is inflammation. So he had joint inflammation, which leads to pain usually. So we just have to remember that it's not necessarily just this like disease that someone has. It's a name for what's happening in their body, namely joint inflammation. Number 5, Bell's palsy. Palsy, this is in the face. I'm not going to describe too much about this other than it affects a certain cranial nerve in the face. And people who have it, they know they have it. So Bell's palsy is one. 6, tendinitis. Similar to arthritis. Tendon is obviously a tendon. Arthro means joint. Tendinitis. So a tendon inflammation. My son had this as well. Number 7, nerve pain. Very common. The nerves of the body get affected by this nasty bacteria. Number 8, heart palpitations. This is a common symptom that people can get, are heart palpitations. Number 9, numbness goes along with the nerve pain type of thing. It just affects the pathway just a little bit differently. Number 10 is cognitive problems, so brain issues, mental functioning. It doesn't work, or mental function, it doesn't work how it's supposed to anymore. So you get this weird brain issue, brain fog, even anxiety, depression, these types of things can affect the brain as well. So there you have it. Those are some 10 pretty common symptoms. Like I said, my son had Lyme. It was not a fun process watching him. That summer he was in a coach's pitch for baseball. So I watched him, this was after he got fixed, right? And he was better. So it was probably during when he was taking the antibiotics, and just watching him try to run the bases in such pain, and he just wanted to be out there going, being out there. Once he was out of pain, he still had trouble moving, and his body wasn't coordinating very well. But I can tell you to this day, he is the fastest kid in his grade, and he can jump the highest. So he's very, very athletic now, and he doesn't have any residual issues from it. If you want to learn more about me, other videos, drlarsen.com, and I'll see you again soon.